कर रहा हूँ. Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institute. Thank you so much for giving us so much love over the YouTube channel, and it's constantly increasing because of your love and support. Please try to repeat each video 2 or 3 times to learn the best from it, because one time you listen the video, you gain lot of information, but when you will start to apply that information, then it will become difficult. So if you will practice again and again, if you will listen to it 2 3 times, then you would be able to inculcate few good lines into your subconscious system as well. And this is what will help you to perform well. जब दूसरी तीसरी चौथी बार सुनते हो तब आपके सिस्टम में फिट होती हैं वो लाइंस, तब आप उनको यूज कर पाते हो. तो प्लीज उनको अच्छे से सुनो. And again, I would, because today is a Monday, today is Monday is a new day. So basically मैं आपको अगेन याद करवाना चाहूंगा, 3 मिनट्स आपको टॉपिक के लिए मिलेंगे, 5 मिनट्स आपको बोलना होगा, 3 मिनट्स प्रिपरेशन टाइम में आप टॉपिक पे कुछ भी लिख सकते हो. यू कैन राइट एनीथिंग ऑन योर टॉपिक, देयर इज नो प्रॉब्लम विद दैट. और उसको देख के भी बोल सकते हो. यू कैन वॉच इट एंड कैन स्पीक इट, बिकॉज देयर इज नो मार्क for facial expression. There are no marks for facial expressions, facial gestures. तो आप नीचे देख के बोल सकते हो, यानी आप अपने टॉपिक को देख के बोल सकते हो जो भी लाइंस आपने लिखी हैं. सबसे इंपॉर्टेंट चीज, वेदर यू आर अ डॉक्टर और यू आर अ नर्स, मैंने हमेशा बताया, राइट फर्स्ट लाइन कंप्लीटली ऑन योर टॉपिक, क्योंकि फर्स्ट लाइन इज द मोस्ट डिफिकल्ट लाइन. खासकर जब आप 2 रोल प्लेज आते हैं, 20 मिनट्स टोटल होते हैं, 2 रोल प्लेज में से पहला रोल प्ले में लिखना बहुत जरूरी है, क्योंकि हम एंशियस होते हैं. सो प्लीज फॉलो दीज स्ट्रेटेजीज विल हेल्प यू पास इजिली. Now let me take you to the topic itself. So you are the nurse who works at gastroenterology clinic. You see the patients, they undergo tests at the clinic. You are now talking to Jenny Vasily, a 25-year-old who has been diagnosed with irritable bowel syndrome at the clinic. The patient is not sure about the conditions and needs advice about the treatment and management. Find out about the symptoms she experiences, type, duration, frequency, pain. Find out about what are the methods, what are the about any triggers she may have noticed, like stress. Explain what IBS in simple language. No clear cause, but intestine probably become oversensitive, smooth muscles becomes overactive, spasms, cramps, IBS, either constipation, diarrhea, or maybe both. Outline the treatment options. Patient has been supplied with medication for pain, diarrhea, and constipation. So medication आप दे चुके हो. She needs to make diet changes. उसको diet changes के बारे में बताना है, stress management के बारे में बताना है. अब देखना टॉपिक कैसे बोलते हैं. और फर्स्ट लाइन को अगेन देखो, मैं आपके सामने लिख दूंगा ताकि मुझसे भी कोई गलती ना हो. सो आई एम अ नर्स हियर एंड आई हैव कम टू नो, और मुझे ये पता लगा है, यू वर्क्स एट गेस्ट, यू सी द पेशेंट्स आफ्टर दे अंडरगो टेस्ट. सो आई हैव रिसीव्ड योर रिपोर्ट्स. तो आप पेशेंट को टेस्ट के बाद देखते हो. आई हैव रिसीव्ड योर रिपोर्ट्स, और रिपोर्ट्स के हिसाब से एंड अकॉर्डिंग टू द रिपोर्ट्स. प्लीज समझो कितने आराम से चल रहा है. अकॉर्डिंग टू द रिपोर्ट्स यू आर हैविंग, बस ये लाइन लिख देना प्लीज, रिपोर्ट्स यू आर हैविंग IBS. बस इफ यू विल राइट दिस लाइन ना, trust me, you are not going to face any trouble with the speaking. First line is the most important thing. So the patient who has been diagnosed with irritable bowel syndrome at the clinic. अब मैं आपको टॉपिक बोल के दिखाता हूँ, प्लीज सुनना अच्छे से. Good afternoon. My name is Bhupesh. I am a nurse here and I have received your reports, and according to the reports, I am sorry to say, but you are suffering from irritable bowel syndrome. Oh my God. Well, nurse, what is that? Could you please tell me? Well, I was just about to ask you, do you know anything about irritable bowel syndrome? Well, no, nurse, I do not have any idea. Okay, so let me explain things one by one. First of all, I would like to ask you a few questions before I explain you things. So could you please tell me what kind of symptoms are you having? Well, nurse, I'm having abdominal cramp, sometimes pain. Okay, could you please tell me what is the duration? Well, it stays on for a long time. And what is the frequency? Well, nurse, I do not know. Sometimes it is constant, it is very frequent. And I have like 5 days, then I have like another week where there is no symptom, then again I have a problem, so there is a lot of pain as well. Okay, so I have got it. See, whatever you have spoken, these all symptoms are of irritable bowel syndrome itself. So I understand, as you have told me, that you are having abdominal cramps and also you are having those frequency at higher levels. So I would like to tell you few things which would be very beneficial for you to understand irritable bowel syndrome. So have you noticed any kind of triggering factors, like anything that you eat or anything that you feel has caused this problem? Do you have any stress? Well, yes, nurse, I have been having a stress because I have taken a new job, and due to that, I face a lot of problems, and over there, it's just a new job and I have to do a lot of work. See, I would like to tell you, see, stress is one of the main causes of IBS. So IBS is kind of a problem where most of the times the right cause of the problem, the clear cause of the problem is hard to find out. So in your case, as you have told me, you are having stress. So stress can be one of the factors. Also, I would like to explain you that in these kind of problem, intestines sometimes become oversensitive and even the smooth muscles become overactive, so this leads to spasms, cramps. And are you suffering from constipation or diarrhea as well? Oh, well, nurse, it's just most of the times it's constipation and then couple of times diarrhea. Well, that is also one of the things, that IBS can either be constipation one, or it can be associated with diarrhea, or it can be associated with both. So after listening to you, I can see it is associated with both in your case. So you have to take certain precautions, and I would like to give you the treatment options. So do I have your consent? Can I tell you about the treatment options? Well, yes, nurse, of course. See, first of all, I would like to tell you that you have been supplied with some medications given by the doctor for the pain, diarrhea, and constipation. So, whenever you are having diarrhea, please take the medications according to diarrhea. When you are having constipation, take medications as per the constipation. And when you are having any kind of pain, take the painkillers as well. And when you are having extreme pain, it is very important to take the painkillers as prescribed by the doctor. Is it okay? Well, yes, nurse, I understand. Also, I would like to tell you about few diet changes which will be very, very profitable for you. First of all, you should avoid high fibrous foods, because sometimes when we have constipations, people normally have this tendency to take more of cabbage, more of salads. But I would like to tell you, please do not take any high fibrous food because they are gas producing, like cabbage, and it can lead to more problems. Apart from that, I would also encourage you to eat regular meals, but take it in a moderate quantity. Don't take the meals too less or don't take it too much. Always eat after every 2 hours, but eat in moderate quantity. Is it okay? So don't keep your stomach empty and neither you make it full. So please understand, this is a kind of a syndrome where you need to be very calculative about your eating. Okay, nurse, I got it. Well, that's nice that you have got it. And the last point I would like to say, the stress management is very important. As you have told me that you are having lot of stress at your job. So job, so stress is one of the main factors which are which is kind of a root cause of this problem. So please understand, you need to do yoga, meditation, and gentle walks every day. Please do not do vigorous activities. So do only gentle walks, yoga and meditation. This will help you relieve your stress and in a way help you to control your irritable bowel syndrome as well. So have you understood everything? Well, yes, nurse, I have. Okay. I'm glad that you have understood everything. And I also would like to tell you, you will start feeling better after following these precautions. And one thing which is very important to be told is that you need to follow all the instructions which I have given you. I'm giving you this leaflet. It contains all the instruction which are important for you. So please follow this leaflet. And if you have any problem, there is also our number down at the leaflet. So you can call on this number if you face any problem. Is that okay? Well, yes, that's fine, nurse. All right. So again, this is this is Bhupesh, and this is your leaflet. And if you have any problem, please call on the given number. Okay. Take care. Thanks. So this is how you execute your role play, and that is how you should do it in the best possible way. So basically, first line always write that good morning, I am a nurse here. So I have received your case reports, and after receiving your results, I have I'm sorry to say that you have been diagnosed with irritable bowel syndrome. Oh my God, nurse, it's a tough problem. Yes, it is. It is kind of an uncomfortable condition, but we can easily control the symptoms. So you just need to follow the instructions which I will give you. So आप उसको instructions दोगे one by one, and then you will take the whole speaking. So this is Dr. Bhupesh from Dr. BKM Institutes executing a role play for OET speaking. Please listen to this role play at least 5 times to get into your heart so that you can speak like this only. Thank you.